health awareness, advocacy, and behavior change. Many of you would have heard the news about a couple seeking crowdfunding of a whopping 16 crore rupee to fund their child's treatment with a rare disorder who needed a drug considered the most expensive in the world, costing over 15 crore. While the amount in this case might have piqued your interest more, we must make ourselves aware of the rare medical condition that is the most prominent genetic cause of infant mortality in our country. Spinal Muscular Atrophy, or SMA, is a genetic disorder in which one defective gene causes muscle weakness and degenerates its normal functions. The affected over the time develop breathing or swallowing difficulty. SMA is typically diagnosed at around 18 months or during childhood, and if not treated, this disease is ultimately fatal. It affects roughly 1 in every 10,000 live births worldwide and 1 in every 7,744 births in India, to be precise. So even a simple mathematical calculation can help us estimate that with over 2 crore births, India can be getting over 3,000 such cases annually. And however, the limited data only puts the number of children having this condition in our country at present at 800. This mismatch itself explains the challenges and the pain these patients will face due to these rare diseases which get very less attention. So to understand more about SMA and what is essential in ensuring timely treatment of this condition, today we have a leading expert in the field with us. So let me welcome Dr. Vykunta Raju KN, Professor of Pediatric Neurology, Indira Gandhi Institute of Child Health in Bangalore. He is also the founder, director of Bangalore Child Neurology and Rehabilitation Center. Dr. Raju completed his MBBS and Diploma in Child Health from Bangalore Medical College and Research Institute, Bangalore, after DNB in Pediatrics, and he completed DM in Pediatric Neurology from the All India Institute of Medical Sciences in New Delhi. And with over 20 years of experience in pediatric neurology, Dr. Vykunta Raju is also currently associated with Cloud9 Kids Hospital, which is Sagar Hospital, Bangalore. So thank you so much, Dr. Vykunta Raju, for joining us today on this program, helping us spread awareness about this seemingly rare disease, but any rare disease in a country of our size does not remain rare. So that's the challenge we face. So let me begin by asking you a very basic question that, as I said, this is the rare disease. So, what is the general scenario related to SMA? What is SMA? And what does a SMA patient's journey look like? When it is diagnosed, how early we can diagnose it?
Yeah, spinal muscular atrophy, what simply abbreviation we call as SMA. So it is one of the second most common genetic problem causing nerve or muscle weakness in the children and even in the adult patients also. So basically, problem is in the spinal cord, a lot of nerves will be there, where anterior cells, where there will be damage because of progressive death of these nerves causes weakness of the skeletal muscles. So it is commonly a genetic problem, even though it is rare. There is no proper definition of rare disease in the world. So various countries tells various incidence of prevalence, but WHO tells that if any disease less than 1 in 1,000, we will call it a rare disease. So it is definitely a rare disease, but as we know that a lot of more than millions of people are there in India, so overall number of patients will be very high. So basically, there are various ways of presenting these children. So various grades are there from 0 to SMA4 types are there. 0 is the one where they can present from the before birth only. In the pregnancy time also, mother can have less movements of the baby and difficulty, a lot of fluid in the body on the pregnancy time, that is polyhydramnios, and decreased fetal movement, that can be a presenting feature. And immediately after the delivery, they can have problem in delivery time. Usually during delivery time, usually child comes to the aid, but in this type of children, they can be a breech presentation where baby has a problem in movement of the body, so it will not turn the baby itself. So it can cause breech presentation. Breech means initially the eggs can come out instead of head. That causes problem. So in SMA 0, where the child cannot able to sustain breathing immediately after the birth, child may require breathing support, respiratory care, and lot of oxygen prolonged time. So they may require lifelong oxygen if baby not able to survive, and they require feeding. They may be having feeding issues also. They may require feeding through the tube. So usually if we don't treat any specific treatment, usually they will die by months, maybe maximum 3 to 4 months or 6 months. So this is a more severest form. The next one is SMA1. SMA1, usually they will be normal till maybe 1 or 2 months of age. Initially child will be normally born and child will be having some movements of leg will be there. But parents usually they will notice the less movements of the body, especially the lower limbs. Legs will be movement will be less, followed by upper limb movements will be less. Usually they will present around 2 to 3 months of age, and they will not be having a difficulty. They will be definitely have not attained usually head control. They will not able to sit also. And most of the times later, around 6 months of age, they develop a breathing problem. They may require admission for multiple times for pneumonia. Later, they develop feeding issues also. They may require feeding through the stomach or to the Ryle's tube also. So later, they'll be having a lot of muscle weakness causing a bone problem. So secondary bone issue like contractures of joint and all these things. Usually they will expire usually by the end of 2 years unless if we don't care proper specific treatment. Most of the time, these children will be affected. Other next type is SMA type 2. Usually they'll be manifested around later part of the infancy after 6 months till 2 to 3 years of age. Usually they'll be normal till 6 to 7 months. They'll be at controllable way. They'll be sitting. Afterwards, usually they'll be having a problem in walking. Usually they will never walk. So they'll be sitting. But all these SMA, the most common feature is they'll be intellectually normal. They will be very bright children. But the only problem is they will be not able to movement. Motor problem will be affected. In SMA2, usually they'll be normal till around 6 months of age. So their main problem is walking, ambulation will be affected. And they'll be again having a difficulty in breathing and feeding problem later in the life, maybe around 3-4 years. Usually, again, they may require admission for pneumonias, and usually they will also die by 6 or 7 years unless we don't give proper care. And the third one, the SMA3, they can present later, like around 3-4 years of age. Initially, they'll be having some amount of weakness, but whatever they started walking, maybe they may start walking, some of them 2-3 years. But by later, like maybe 5-6 years, they'll stop walking, or they may walk, but with a lot of difficulties, may require assistance, they may not run, they're not able to climb. They have a problem in walking also. They're able to walk, but not like normal people. Again, they'll be having again breathing issues, pneumonia, all those things. They may require specific treatment. Unless if you don't treat, they'll be having a lot of problem in activities of daily life. And SMA4 is a one least severe form where usually you'll see in adolescent or older adult people. Initially, they'll be normal, initially 10, 20, 12 years, but later they will develop problem in ambulation, like walking and daily life. They'll be having a problem in living in the normal life. So these are the various
leads to, this kind of genetic problem?
Yeah. So progression, as I said, it depends on type of SMA. Type 0, as I told, it present before birth, and usually, unless if we don't treat, usually they will die within a few months, maybe 3-4 months maximum. Type 1, again, it present around 2-3 months, and they will progress very rapidly, and most of them, they will die by 2 years of age. So that is a rapid progression. Type 2, usually they will start around 7 months to 1 year of age, and they may survive up to adolescent age group also, unless they don't face any complication of pneumonia, other things. And SMA 3 also, they will present the later part of the first decade. They will survive usually second and third decade also. Type 4, they will be presenting the adolescent. They will survive lifelong, but with a lot of problems in the activities of daily life. So in general, type 0 and 1 is a rapid progression.
Okay.
Others are slowly progressing.
Okay.
And regarding the cause, basically it is a genetic disease where it is inherited from the parents. So where usually parents will be carriers in any affected child, where the chromosome problem is a 5 and gene is a SMN gene, cerebral motor neuron gene. So when there are two carriers, parents, both mother and father, so child may be chance of getting 25% chances. 1 in 4 children may be affected with this disease. And usually the carrier status is common when you are married in the same community or same relatives, the chances is very high. So especially it is common in India, especially South India, it is commonly seen consanguineous marriage, what you will say. So this is one of the reason. And primary problem is a genetic problem. This is not an acquired condition, and it will not transmit from touching the baby. It is basically inherited from the parents.
Mm-hmm. Okay. So this is basically a genetic problem which starts from the, comes from the parent itself.
Parents. Yeah.
Okay. So, Dr. Vykunta, in terms of screening of these patients, how soon you see that these patients or these children with the SMA problems are identified or diagnosed? Because I believe that apparently there would be a lot of delays. I don't see that if it's a type 3 kind of or type 2 kind of situation where you are saying that it can be visible in 6-7 months or 8 months. The natural course of care would be the parents going for maybe pediatrician or maybe orthopedician. How quickly they are diagnosed that they have SMA?
So regarding the screening, it is there are various methods of screening. So from before conceiving, that is pre-conception screening, or even before marriage and also. So before marriage, you can consider that if it is very common, some genetic disorders will be very common in the community. SMA is one of the things. So they can go for carrier testing in the parents before marriage only. So they can avoid same carrier status. So that is one of the options. And before conception, they can before conceiving also they can go for carrier testing. Both the parents. And after conceiving, there is a the testing can be done in the mother itself, mother's blood. So whether baby is affected or not, that is also one of the options. The most commonly done is after the baby is born, that is newborn screening. That is there for many disorders, but it is recently developed in spinal muscular atrophy, but not there in India because of many reasons. So one of the reasons is once if you do a newborn screening, you should have a proper treatment and you should give proper treatment. It should be very cheap. So if you diagnose the disease and treatment is not there for the parent, it is ethically not correct. So it is a lot of ethical issues in India. So currently there are the options are there. You can diagnose the disease if you are suspecting at the time of birth only. So there are various methods of screening to diagnose. And regarding the diagnosis, the spinal muscular atrophy, it is relatively very easy to diagnose clinically. So maybe some complication you can face, sometimes it can resemble some other muscular or neuro problem, but in general, usually they will be initially normal and later there will be loss of motor milestones. Like initially but later they will lose these movements, but they will be very bright children. They will understand everything, but only thing they are not able to move and do activities. That is the main issue.
Hmm.
when you are examining the child in the hospital, they can have muscles looks very flabby. They're very weak muscles. They are not able to move the limbs and legs. And later they can have breathing problem and they can have feeding problem also. And when you are examining the classical sign, that is the fasciculations will be there in the tongue. That is very relatively very specific sign for this disease. Usually none of the other disorders you will see. That is very characteristic of spinal muscular atrophy. That gives important clues for diagnosis of spinal muscular atrophy. Sometimes other neuromuscular problems like congenital muscular dystrophy, congenital myasthenia, or congenital myopathies can be mistaken for these disorders, where some simple blood tests like CPK should be done. After doing all these things, to confirmation of the diagnosis is important. That can be done with a simple blood test in the a baby. That is a genetic test. That is SMN gene test by MLPA. So that is easily available all over the India. So that can be done, and to confirm your diagnosis, to give a confirmatory test, and also what is the severity, it will give more details. So it is easily available most of the places in India. It can be done, and most of the times it can be easily suspected by most of the clinicians also.
So, Dr. Vykunta, you are saying that things like pre-marriage, preconception, kinds counseling or screenings can help, prevention of such disease, which is kind of quite disastrous.
Yeah.
And you are also saying that in the, I think it can also be identified at the stage of embryo also.
Yeah.
And which too can help in prevention. But once the child is born, one of the point I wanted to understand that how early diagnostics can help in kind of mitigating the risk of this problem, or will have a better outcome in terms of longer life for the children. How early diagnosis can help?
Yeah, so early diagnosis is very important. So that is usually we will diagnose early disorder, these treatable conditions. There are many rare disorders, genetic disorders that is commonly seen in India and all over the world. You will screen the babies, newborn screen, what you will call. So this is newborn screening. It is common worldwide, all over the world. So this test you will do simple blood test. You will detect many disorders. So many of these metabolic and genetic disorder you will screen maybe more than that, depends on which country you are there and what are the operability, all those factors. So commonly diagnosed condition like in India or any other countries based on their genetic patterns. So I will screen for many disorders. SMA is also included the screening test in Western countries, but currently not included in India because of many issues. So, because it is routine in US and other countries where if you diagnose early in the newborn period, there is a treatment is available. So, if you give treatment, chances of successful treatment and complications are very less. So, if you diagnose the child with immediately after birth with this screening test, so they can start treatment like whatever the treatment option we'll be discussing later. So, chance of complication like babies going for pneumonia, feeding problem, all those things will be less. So, they can improve very fast. The problem in India is even if you diagnose, the parents are affordability is issue. So even if you diagnose a newborn period with newborn screening test, so a lot of ethical issue comes. So if you diagnose, if you tell, parents cannot do anything. So there will be a lot of psychological issue. They feel that even though they have baby, they are not able to give proper care for the children. So a lot of these issues are there. Currently, government or any other authority is not recommended as a screening test of SMA in India currently.
Okay. So we are not doing SMA in the newborn screening primarily because there is no availability, or there is no assurance of treatment for the children if they get diagnosed of it.
Yeah, that is one of the reason, and affordability is one of the reason, and tests also not easily available. This newborn screening, whatever is there, there are many other disorders. Simple treatment also there, like hypothyroidism, thyroid problem. Like similarly, there are many other disorders. Simple treatment is available, but they are all not universal in India because of many reasons. Because of most of the babies still born in the rural area, in the home delivery is also still common, and government setup and private setup. So it is not universal in India, not only SMA, but many other rare disorders cameras, they are not done routinely because of many reasons. Not only the treatment option, because of facilities availability and manpower, all those reasons.
Oh. But is there in any, maybe in private sector, is there newborn screening happening to the level where we are including SMA, or it is largely SMA is out?
No, currently nobody is doing in India as of now, but outside the USA they are doing routine newborn screening. But in India it is not included any private sector or anyway. But if you are suspecting, if there is a strong suspecting, you will call as diagnosis, you will not call as a screening test.
Okay. So since there is no screening for it, so obviously once the the symptoms start, or there is a apparent manifestation of the disease, parents will go to the doctors, and then the treatment comes into the picture. What are the treatments available in that case in India? And as I mentioned in my opening remark also, this one of the treatment which we heard is so expensive. So is this the only treatment available in India, which is 15 crore was the amount which we read in the newspapers, or there are other type of treatments also which are not so expensive?
So there are various modes of treatment. The initial basic treatment is basically multidisciplinary management. Multidisciplinary, with a lot of people requires for management of this condition. Not only the doctor, it requires pediatrician, neurologists, and physiotherapists, pulmonologists to care of breathing, gastroenterologists to take care of feeding. So even though specific treatment is available recently, these all supportive care is also equally important. So all children require proper care by all these multiple specialist doctor. So they should start proper physiotherapy from initial point of diagnosis. They should take care of proper breathing and feeding issues, all those orthopedic problems, all those things. So this is a must for whether they require specific treatment or not require. These simple basic things should be given for all children with SMA. Regarding the specific treatment that is available for the last few years outside India and also India, there are various three modes of treatment available. One is gene therapy, other is an nusinersen. That is an injection form that usually will be given to the spinal cord directly, regularly. Other is a recent one, third option is an oral drug. So there are three modes of treatment available. So coming to the gene therapy, that is a costliest drug currently available in India, all over the world. So it is a one-time treatment. So some of the advantages and disadvantages are, it is a one-time treatment and it can be given like a single injection to the vein. So the only thing is it should be given, most of the time it should be given less than 2 years. The chances of improvement after 2 years is less likely. And other disadvantages are many. One is a very expensive treatment. Most of the people in India affordability is not affordability is a major issue. Other things are if you diagnose later, we cannot give. And the long-term effect of this treatment, we don't know exactly. Like what happens after 5-6 years, long-term studies are not there. The recent few studies shows that the effect of this may wean off after a few years. They may require other types of treatment also. So after this is the vector, that is gene therapy. Vector can be converted to something else also. It can be converted to some other things. We don't know the long-term effect of this. So there are many disadvantages. So also not only the cause, there are other medical issues also. Later they can develop antibodies. Their drugs may not work also. These are some of the disadvantages. The second treatment is nusinersen, where the drug is usually given to the spinal cord, that is intrathecal route, that will be given regularly, initially maybe weekly twice, later once in 2 to 3 months, that will be given again lifelong. The problem is it requires admission costs and doctor expenses. It should be given through the spinal cord. It is an invasive, trauma will be there, painful for the baby. And again, it is also a very costly treatment and it should be again lifelong treatment. And where spinal cord, it will be given to the spinal cord, where these SMA children were having a problem with spinal curvature later. If they have spinal scoliosis is there, they cannot be given because of difficulty in administration.
Mm.
So these are some of the issues. Is second mode of treatment, that is nusinersen. The third option, that is oral drug, that is Risdiplam, that is currently available in India. So it is a simple drug. It is easy to administer because it can be given through the mouth. That is the only drug currently available can be given through the mouth. So only some of the advantages are, that is the one which is oral drug, and it is for the first time it may be cheaper, but long term may not be so cheaper. Initially to purchase may be cheaper initial management, and it can be given for any age group except less than 2 months. It can be given after 2 months for any age group, any type of SME. The disadvantages are, it is again a lifelong treatment, and it is also long term. It is also a very expensive drugs. So these are some of the disadvantages. And you should, before advising all these drugs, you should counsel that not only the treatment, they require other care also, the multidisciplinary care. Along with this specific treatment, they should concentrate, they should spend a lot of time, parents, regarding physiotherapy, all breathing problem, and also some feeding problem. All those things, initially it will be a problem. They need to take care of all those things, and they should prevent infection also, because infections are very common when you're going to hospital and coming. So all these things should be taken care, because if you don't take care all these, you may be knowing that recently child has received a 15 crore drug and child is expired after a few months. So such an expensive drug, if you give and if you don't take care of other measures, so there is no point of giving 16 crore medicine. So equally important in India, especially, not only the one-time money, they should have a proper basic support for the child, like proper care for breathing and also feeding issues, proper physiotherapy. All those should be there. Not only just giving.
And they are relevant or important for all three type of treatment.
Yeah, all the this is must for all the type of children.
Okay. So. Since you are saying that we had this one-time treatment which is very exorbitantly expensive. I don't see that the affordability is the issue here, because the treatment cost is so expensive that I think most all the people would not be able to afford it. But in that, you're mentioning that this new drug which can be administered orally also. Has it changed the possibility of the treatment, and how do you, what is your take on that? Is it going to substantially help? At the same time, the cost here is also, you are saying, is quite high. What do you see?
This
with the support of the government, or with the support of this, the new rare disease kind of policy also, where the government also says that the crowdfunding can be an important aspect to it. Do you see that the patients can really get that important?
Oral drug, it is there are some advantages, as I told. It doesn't require any hospitalization. Usually simple syrup formulation. It can be given in the home only. And at a single point of the initiation of the period, it is not so expensive. So most of the parents may convince, or they may afford for initially maybe whatever the maybe crowdfunding, whatever the funding for the government, some insurance scheme they can start. As we know that most of these drugs will be getting cheaper once they goes for longer time, because once the many patients purchase, they will usually decrease the cost of the money. So later they may be cheaper also. So that is one of the options. So at a time, a single time to spend, it is not so expensive compared to other drugs. And easy administration is one of the other most important thing. Easy to admission, they can do same thing in the home only instead of visiting to hospital regularly, and it is not a painful condition also. So these are some of the advantages, and there is a chance that usually most of the drugs initially will be expensive. As the number of people start using, the drug price usually decreases most of the time. So it is one of the best option currently available compared to other two options.
Many of these drug companies also do some kind of compassionate usage program and all that. What has been your experience on that line? Has it been helping some of the patients?
Yeah, definitely it is helpful. So this oral drug also, they have done a compassionate program, and many people are getting this drug. And only as it is already launched and in India, so usually the chance of those programs usually they may not give after launching. Usually before launching they are given for many patients. So that is one of the option. They are given for other drugs also, and this oral drug also given. Many patients are benefiting now also.
Dr. Vykunta, how do you see that after this entire national rare disease policy which government has brought out, the Ministry of Health and Family Welfare, and they have also created a new platform for crowdfunding support. They have been also kind of vocal in terms of asking CSR spenders also to help in the people having these rare conditions who need expensive treatments. How do you see that unfolding, and what is your specific input on that?
Yeah, definitely this rare disorder policies definitely have our country has some policies at least to start with. So you have some guidelines are there, so they are useful when you are, because some patient may be using for some other purpose also. They have proper guidelines are there. So how to do this crowdfunding, how to start initiation. So these are some of the guidelines are there. So because government cannot spend so much money, because there are many other disorders where so much money can improve the quality of life and other things compared to these rare disorders. We cannot depend on government. We cannot blame government also because of many limitations are there. So there are these crowdfunding other methods are there to raise the funds for these patients. So corporates and those who are donating, they can help for these children so that they will benefit along with the government also.
Do you see have you been able to kind of facilitate such treatments through some corporate coming up forward and helping? What has been your experience?
Yeah, some of them are helping definitely with the crowdfunding for these drugs, not only the SMA, but some other drugs also if they need. So they are definitely benefiting, many of them.
Yeah, thank you so much. So I think that's a good important I think silver lining in this whole problem. What is your suggestions, Dr. Vykunta, for the people who have these problems at home, and they have been kind of trying and not able to get the treatment? What are the normal, what should be the next step for them? With the new drugs also on the horizon, what should be the way forward?
So the first thing is, once diagnosis is made, so that depends on many factors. One is type of SMA, and what is the stage of the SMA, what is the family background and affordability, and many other things, even education state of the parents and their understanding also. So baby is very late stage. If they comes, that commonly happens in India, like type 1 SMA, they usually comes with breathing problem, pneumonia. So they should not think that once if you give this 16 crore medicine, our baby will going to recover. That should not be kept in mind, because there are many other issues. Once it goes to the ventilator support, the coming back with this treatment, and further child may require again ventilator support, all those things. Along with medication, they require a lot of family support for a child, for physiotherapy and other medicine help and other subspecialty consultation, frequent visit to the hospital. All those things, they should think that just spending money itself will not going to solve the problem. So all these factors they should consider. So they should not think that just drug has come, it will going to solve the problem. Money is not the only issue. So even though some of them are given, they should think other part of the treatment also important, and they should expect that just giving will not help. Sometimes if infection comes, if child SMA, they are given some treatment. If child develop any pneumonia for any reason, like some normal child can recover fast, but this type of children may not recover fast. They may require for admission and ventilator care. Once they go for a ventilator, usually the chance of coming again, it is rare. So all those things they should consider, not only the specific treatment.
Thank you so much, Dr. Vykunta, for I think you have very well described the all the possibilities and also the way we should look into kind of managing of this disease. Obviously, this is rare, but at the same time, as I said, that in the country of 1.35 billion people, nothing remains rare. And there are certainly several families who will be struggling because of this disease. Important here is that, as Dr. Vykunta also highlighted, that the governments may not be the only solution in this case, and that is where the role of society, the role of corporates, the role of even the companies making drugs, they are also contributing, helping through various programs. So when it comes to affordability of the treatment, we should try to provide a more social support to these patients, but at the same time, for these patients and their families and these parents who have children with SMA, spinal muscular atrophy kind of rare diseases, they also need to be prepared for looking towards a holistic treatment. As Dr. Vykunta said, that this is not just about a drug; it requires a lot many other I think interdisciplinary management which is needed to manage these children. But yes, at the same time, the life is precious, and they too have the chance to survive with the drugs available, with the good intent of the society available, and with the experts like Dr. Vykunta being there to help them. So thank you so much, Dr. Vykunta, for your time today for this program, which we have been doing for the awareness of this rare disease. But it is important to know, because every children who has this also has the the right to survive, and we as a care providers or as a society should try to do whatever we can do for them. So this program was supported by Roche in their public interest initiative, and thank you so much, Dr. Vykunta, for your time.
Thank you.
We look forward to see all of our audience, and I'm sure this program is going to help them in understanding about this disease, and will help them convey this message to many others whom it can benefit. So thank you so much. Looking forward to see you all again. Thank you.
Thank you.